All right. Hello, everyone. Welcome to the Wellness Center. I am Megan Rowe, and I'm manager of the Wellness Center. And I am here today with Joseph Arisa, who is one of our massage therapists.
Hello, everyone.
Hey, Joseph, thanks for joining.
Yeah, pleasure to be here.
Are you in your massage room?
I sure am. Who's look around?
It looks so lovely and tranquil.
Thank you, Megan.
Well, we had some questions for you that were submitted from some of our clients.
Absolutely.
So we'll just run through those to get people's questions answered. But before we do that, just a real quick review of what your background is in massage.
Yeah, absolutely. So I'm one of the massage therapists here at St. Jude Wellness Center. I've been with this team, I think about since 2016, so 10 years. Mainly my specialty here is I do a number of massage modalities here. So primarily myofascial release. I do craniosacral therapy. I offer Hawaiian lomi lomi massage. I also stretch. And also for a season, I was providing Watsu aquatic body work as well. So that is my role here as a massage therapist, and I just absolutely love working here.
So many modalities. I love it.
Thank
Well,
you.
that actually leads us into the first question that was submitted from one of our clients asking about what you do. What does therapeutic stretch service mean? What does it consist of? Is it advisable for someone about to have hip surgery?
Yeah, absolutely. Therapeutic massage, well, therapeutic stretching is one of the unique treatment that I have developed throughout the years. And unlike yoga or Pilates or what they call PNF stretching, where there's a lot of active participation in the stretching, therapeutic stretching is more of a passive type of stretch. What that looks like is pretty much the person that is receiving a therapeutic stretch is on a table, fully clothed, and the whole aim is to apply very gentle yet firm pressure on certain angles of the body. So really it is beneficial to increase range of motion, also help a little bit of the stiffness. Now, I'm never going to stretch anybody beyond their threshold. I always work with the body's limit. Just FYI, I'm not one of those therapists that pain is no gain, type of situation. A lot of the techniques that are used in therapeutic stretch comes from my background in Lomi, which is a native Hawaiian lomi lomi body work. And the whole emphasis is on the attachments of ligaments and tendons. And by manipulating these tendons through gentle stretching, it then affects the muscle tissue as well. So what that typically looks like, I'll do certain maneuvers where it's very gentle and I'll apply certain pressure in certain points. And there's a lot of breath work involved as well in this work. Typically, I would suggest it's about 15 minutes. 75 minutes would be ideal for this type of treatment. And those who benefit from it, it's a very wide range of individuals. So anybody, you had asked about those who are having hip problems or possibly having hip surgery in the future. This is excellent because I'm working into the tissue. This actually kind of works well with prehab as well. Again, this is a very, very gentle form of stretching. It's not aggressive. What I did want to make mention too is I did jot some notes down. It does help improve circulation, flexibility, range of motion. This type of stretching also prevents and facilitate healing back pain and even improve posture. So in the day that we're living in now with all the technology, we're on our phones. So we're at this, body position here. There's been an alarming increased rate of cervical neck tension. So a lot of us who are on our tablets or on our phone morph into this position. So you have a protracted shoulders, neck goes forward. Actually, I have a little chart here. It says how much extra weight are you putting on your neck, if you could see this. So about at a neutral position, it's about 10 to 12 pounds, and it goes up. So at 15 degrees, there's about 27 pounds put on the spine. And then increasingly, as you protract forward, for instance, 45 degrees, that's about 49 pounds of pressure on the spine. So as you can see, if you're on your tablets, and you can tell by looking at your screen time, how much time you spend on your phone or your tablet, your body and all that fascial structures that are located in the chest, even to the neck. And as you know, fascia connects everything in the body. What stretching does opens up and frees up that space, helps lubricate that joints and re-educates those muscles.
Wow,
So, and
that's
if that's,
fascinating.
it is
If you
fascinating.
could send me that, we'll put that in the show notes here too. I'd
Absolutely.
like to see that.
Yeah,
Oh,
and
and
also the I also want to mention too, in my Lomi Lomi background, our focus in the stretch is we're working with the GTO, which is the Golgi tendon organ. These are the pain receptors that are found in the tendons, and so by manipulating these tendons very gently, it then sends a signal to the central nervous system into the brain that then sends a response back to the muscle tissues to relax. And so oftentimes people who are experiencing this type of work either feel very energized or they just want to go to bed. So it's very calming. You get so much benefits through therapeutic stretch.
wow.
It's one of my favorite treatments to receive and give.
Wow, so interesting. And it makes so much sense. I've had it a few times with you personally, and I always feel like I walk out taller.
Yeah,
Like I've
yeah,
been stretched literally up and
yeah.
down.
One of my disclosures is you might grow a couple inches after.
It's so true. I feel it. Oh, that's fantastic. I need to
Yeah.
book one right now. Your second question
Yes.
was I miss the MFR therapist who retired. That was Barbara.
Oh, of
I
course.
heard she had trained some other therapists. Who are those people and are they trained by John Barnes?
Yeah, absolutely. Excellent question. Barb was so instrumental in really bringing on myofascial release here at our center. And we're so fortunate and blessed that she's actually introduced to us the myofascial center in Tahunga by the gal. Her name is Frances Nicole. She's been doing ongoing training for our team. So I have to say, I think all of our therapists are trained in MFR. And I have to say specifically John F. Barnes, because a lot of times when I receive clients coming in expecting MFR, they don't really know there's a lot of different types of MFR. There's structural integration, there's Rolfing, there's myoskeletal techniques by a gentleman, his name is, forgot his name, but all of it's coined myofascial. But our technique here is based out of John F. Barnes' work, which is a very gentle yet effective approach to dealing with myofascial pain and dysfunction. So I usually educate my clients too. All of our therapists here are on the same page as far as delivering the same type of treatment.
Yeah,
Now,
something I didn't know either until the whole team did that, that there were different types of myofascial.
yes, sometimes it's pretty interesting because I had an actually individual that came here asking for myofascial release, and they're asking for more pressure. It's like, oh, I have to educate them. This is not the type of myofascial release that we do here. Yeah, so it's all about educating our clients.
Yeah,
I
yeah,
hope all of
awesome.
our therapists are highly skilled and trained in John F. Barnes' approach. And I'm very, very excited that we're gaining some recognition within the community. And then also our doctors, our networks of doctors are referring their patients to the Wellness Center. And hopefully our intention here at the Wellness Center that this will be a hub of MFR. So people from all over communities will come and build relationship with here and also receive treatments.
Yeah, yeah. And
Yeah,
I'll add too that Francis, who the whole team received their training and certification from, is certified through and with John Barnes,
that's correct.
as was Barbara. And so while you all didn't learn directly from John F. Barnes, you all learned his model, his certified
Right.
model.
That's
And
correct.
Barbara continues to give continuing education to all of you as
Yeah.
well, which is pretty
Yeah.
neat.
Every move misses are all our clients, even myself, all our staff. She was just a gem here. But we're carrying on the work thanks to her.
Yes, yes. And she still does some workshops out for our community as well. So this is another one about your types of services. What is abdominal massage and why would someone choose that?
Ooh, very interesting. It's one of my favorite modalities. In Hawaii, there's a term called upuhuli. This is manual abdominal visceral manipulation. So it's a very specific type of modality that really focuses on the abdomen. And when you look at the abdomen, this is our center. And a lot of the belief systems culture is that this is the area of the soul. We carry a lot of tension, especially nowadays when our cortisol levels are pretty up. It affects our central nervous system. Everybody's highly stressed. There's a book that was written out not too long ago called The Third Brain. It talks about how our thoughts affect our gut. And that is so true that there are some neuroreceptors. When you think about trauma, the tendency, one of the defense mechanisms is to coil up. So you have this abdominal wall that then begins to constrict and tighten. So if you can imagine the fascial structures in the abdomen begin to tighten up, it will also affect your digestion. So peristalsis is affected. In my work, I also notice those who have chronic low back pain tend to also have abdominal disorders because the psoas muscle and the iliacus, which is part of the hip flexors, they attach from T12 to L5 and come around to the front and attach to the lesser trochanter of the femur. And so when that's constricted and tight, it'll cause a little bit of an anterior rotation, and that also affects the whole entire abdomen. So what that looks like in abdominal lomi lomi, I gently apply very gentle pressure using oil. And sometimes I'll use a hot, warm rock. It's a volcanic rock. I actually have one here. This is what it's like. It's a very smooth rock. And so a session is typically about 20 to 30 minutes, depending on the duration of the treatment. And my goal is really to release a lot of the structural tension that's in the abdomen, but specifically focusing on the psoas muscle as well. So those, I actually wrote a little bit about that. Upuhuli, or abdominal massage in Hawaiian, is pretty much, it's defined as to turn the stomach. That's really what it means. There's other cultures that phrase it like hara or visceral manipulation here in the West. But it's very, very effective for those who may experience low back pain, respiratory problems. That also affects the respiratory intercostal muscles are affected as well. Postural issues, irritable bowel syndrome is a big one, indigestion, excessive gas, stomach pain, a tilted uterus, menstrual disorders, to name a few. Again, the whole intention of abdominal massage really is to stimulate the organ, stimulate the digestive system. That way, you're eliminating regularly a healthy way. Yeah. Yes.
Yeah. I know Lynn, our dietitian, and I have referred a couple of people with IBS specifically to you for that service because IBS it's stress related in general. So any massage is going to help with calming that nervous system, but specifically in the gut, they just have a lot going on with tightness in there. So
and oftentimes too, given the nature of the abdomen, we carry a lot of emotions there in our abdomen. So it's quite interesting. I wouldn't be surprised. I've noticed this before and experienced that sometimes individuals receiving abdominal work will then have an emotional release, which is
heard that too.
Because this is a very vulnerable spot, but there's nothing that I'm doing to project a reaction. It's just what the body's telling me at that time. And so oftentimes receiving abdominal massage, yes, they get the release. Yes, they feel their hips begin to unwind. And then with that too, sometimes emotional things may come up.
So good to know to prepare for that maybe ahead of time. that is normal and fine if that happens. Great. Let's see. This is an interesting question that segues from that. What benefits from massage often surprise people?
Ooh, this is a good one. Kind of dovetailing to what we were talking about just a while ago, how the emotional release is something that surprises individuals. There's so many times when I'm treating an individual that after a session, they felt like they had a therapy session, is because the body's talking. And as you receive a massage, there's a lot of things that are going on with the brain. The release of oxytocin, that really good chemical. You got dopamine, serotonin, endorphins being released. And in that, you experience a sense of calm and stillness. There's a great book. This is actually there. It's called The Body Keeps the Score. It's a really good book for any practitioner or anybody who wants to understand the connection between the mind and body, that our bodies tell a story. There's a thing in myofascial release that we say, it's called issues in the tissues, and that is so true. Our bodies hold these tension spots, especially if we experience trauma or any type of high level of stress during a session. These things again tend to begin to manifest in a way, and it's normal.
Yeah, I think
Yeah.
I felt that personally the most when I was having prenatal massages because there was always so much baby activity going on
Right.
after my massage. It was like, what is happening? And you just know that there was that connection from what just
Yes.
happened to the body physically to the baby.
Yes.
So,
That's great.
so cool. Yeah.
I love it when
Uh,
I'm working prenatal massage because it's like I'm working on two individuals all at the same time.
yeah, that's such a sweet way of looking at it. I love that. This was actually my own question that I added because I know what we're working toward at the Wellness Center with our new Parkinson's programs.
Yes.
Um, can massage therapy help with tremors and rigidity symptoms that often come with Parkinson's disease?
Oh, absolutely. With the progressive neurological disorder, there's a lot of tension and fascial tension with Parkinson's. So massage therapy absolutely, absolutely, definitely helps, especially with the spasticity and the rigidity of the muscles. Massage is very, very beneficial. But then also, it's very calming to the nervous system as well. Actually, Ramsey, one of our other therapists, did a really great review on Parkinson's, I think a couple months ago. And she had said massage therapy is an increasingly recognized complementary approach that can help manage symptoms, improve quality of life, and promote overall well-being for individuals diagnosed with PD. So a lot of the effects of the massage helps relax, reduce rigidity, improves mobility and flexibility. It's really good for pain management. It also enhances sleep quality. Again, these wonderful, good hormones, chemicals in the brain being released. And then emotional support and stress reduction. There's nothing like a really amazing touch and that intention in this situation. It
So
really
true.
helps with,
Especially when you're dealing with condition management, it can feel sometimes very isolating and
oh,
lonely.
absolutely.
Oh, I agree. Yeah.
Yeah, the power of touch.
Yeah, absolutely. Those were all of our client questions, Joseph. Was there anything that you would add as to perhaps this idea of medical massage that we promote so much here
Mhm.
versus other massage spaces, other massage businesses? What's a little different
Yeah.
about here at the Wellness Center?
Yeah, well, given the fact that we're under the umbrella of the hospital working in a medical facility, thanks to you and at Margaret, we are medical fitness, I guess second year already. So we're very excited. What makes us very unique, aside from like the spas, is that we truly are a medical facility offering medical massage. So all our therapists are trained in oncology, certified. Manual lymphatic drainage, Waters technique for lymphedema, we offer that as well. Myofascial release, John F. Barnes. Myself, I practice craniosacral therapy, Upledger, which is really great for chronic head pain. And what makes this very special is that we pull together a variety of different populations. So we have neuro rehab, we have pain management, we have orthopedics, we have oncology. So we have a lot of specific, unique populations that we deal here. Whereas at a spa, yeah, we not so much of that population. It's more of the healthy. But anyhow, um, another great thing is that we can pull from other health professionals and refer them out to our dietitians, personal training, all the elaborate classes that we offer to our community. So truly, we are a medical facility and also a medical massage provider
Yeah.
here at the center.
Yeah, which I think is important, especially, before I came here, which was now many years ago, I never really realized that was a thing, medical massage, that you could actually help manage true symptoms
Mhm.
through the power of touch and healing. And it's so interesting
Well,
and really
yeah.
good for the public to know. So
Absolutely. And it's just amazing to hear our own physicians within our network referring their patients. It's like one of our dear patients, one of our doctors often refers her patients to our center. And she would say, oh, Dr. So-and-so referred, I need this, I need this, I need this. And so it's a constant thing. So we love the referrals from our physicians.
yeah. Oh, Joseph, thank you so much for taking
You're
the time in
welcome.
your very busy schedule. You're always booked up, but people can look for you in both the St. Jude Wellness Center app as well as online to book an appointment with Joseph or any of our massage therapists. So thank you so much for giving us
You're
some of your
welcome.
insight and your expertise.
You're welcome. Look forward to seeing everyone here at the Wellness Center. Thank you, Megan.